Good morning. Thank you for coming to Utica on this wonderful snowy morning. I hope everyone had a nice holiday season with family and friends. This is an occasion for us to honor our nurse practitioner students who have completed the Family Health Assessment course, which is the first clinical course and one of the most intense courses of the beginning of the program. They have worked very hard, as many of you know who work side by side beside them, being their patient. I appreciate everyone's supporting the students. They've worked very hard, and this is just a little celebration so that they feel that they can go into the clinical area prepared. One of the things that we're most proud of in this program is that when I go out and visit the students, once they're out in the clinical areas, the preceptors always say how well prepared our students are. And it's because of this past semester, how hard they've worked, learning as much as they have, that they go into the clinical arena feeling confident and doing a really nice job with our patients. So thank you all for taking the time this morning to come and honor our students. Thank you. And next, I'd like to introduce our esteemed Dean of the College of Health Sciences, Dr. Joanne Joseph. She is a great support to the students and to the faculty. She does a wonderful job as trying to get us more clinical sites and working very hard day by day with all of us faculty and students. So thank you very much, and I'd like to introduce Dr. Joanne Joseph.
Good morning, and congratulations to all of you as you now take the next step in your training. Today, you done the white coat and all that the white coat symbolizes. The question is, what does the white coat symbolize, right? What does it mean? So I thought that I would, as an outsider to nursing, well, sort of an outsider to nursing, tell you what the white coat means. The white coat actually represents the healer in you, and not just an ordinary healer, but a healer who's able to not only perform the typical types of medical or psychiatric care that goes along with Western type medicine, but to do so in a holistic and humanitarian way. That's what distinguishes you. And where did this come from? Well, actually, it came from two people who started this whole tradition, and that was Dr. Gold and his wife. Dr. Gold was actually a pediatric neurologist. So you can imagine that he saw a lot, and what he had to deal with was probably not always, quote unquote, curable. His wife was an educator, and one of the things that he was struck by was how little humanism there was in standard Western reductionist medicine. So his goal, Dr. Gold's goal, was to infuse humanism back into medicine like it was at one time. So he started the Gold Foundation, and that's where the white coat ceremony became so popularized. So the question then is, what's humanism, right? I'm an academician, sorry guys, so I have to break things down. I find it very interesting that the gold standard for humanism consists of 4 things. 1, compassion. 2, collaboration. 3, your ability to rely on scientific or evidence-based practice. And 4, your willingness to dedicate your life to equitable health care. Those are the 4 qualities that characterize humanistic health care. So let me reflect on what each of those things mean. Because when you take this oath in a few minutes, these very characteristics are, reflected in the oath that you're about to take. So what is compassion? Compassion is the willingness to relieve suffering. That's pretty heavy. So what does it mean that you have to be able to do in order to be compassionate? You have to be able to get outside of your own headset and really experience what that other person is feeling. That's very difficult. And it's something that is exhilarating on one hand, but it's exhausting. I can speak from experience. It is exhausting on the other hand. But humanism requires that. What's collaboration? Collaboration means that you're willing to be a partner with other colleagues, with your patients and their families, and with other institutions that might support your work with that patient. What does collaboration require? It requires that sometimes you understand what your own shortcomings are, that you know when you don't know, and you make that referral, or you look for that consult. It also means that you're respectful, and you're able to be respectful of other people's opinions, and that you got a flexible headset. What can I tell you? That's what collaboration's all about. Scientific evidence, you all probably know what this is, and I'm not going to go through the whole network of scientific evidence. I'd give you all asleep, I'm sure, in a few minutes. But scientific evidence means that you have the content knowledge, that you know how to critically evaluate and synthesize information. And that's, some of those methods courses that you've had to take and you wonder what the heck that has to do with your training. It has to do with a lot of your training here. And then equitable care means that you're able to, and you're willing, more importantly, to provide the service regardless of creed, color, or economic status. That's what we're asking you to do. So when you put that white coat on and when you take that oath, that's what you're committing yourself to do. It's a pretty tall order. I know that. But I think I speak for the faculty and myself. We know you're up to it. And more importantly, we are exceptionally proud of you, and we are grateful for the service that you are now providing and that you will. God bless you all.
If I can ask the white coat candidates to please stand. And I'm going to have you come to the left of the stage. Lindsay Cyrus. Sophia Eunice. Kylie Cheesebro. personality, apparently. Sarah Jacopino. Megan Rollier. Cassandra Warbach. Melissa Connor. Andrea Martin. Anthony Scalise III. Tansha Nottingham. Megan Tardungo. Sorry. Abigail Rogan. Tiara Hawkins. Megan Castle. Jackie Decker. Christina Encarcion. Brooke Tennis. Kimberly Labar. Paige Hebert. Matthew Pittman. Anthony Lafoche. Kevin Faradino. Nicole Dache. Jordan Odin. Alicia Hatoy. Janine Wallace. Karina Diaz. Carrie Trevisani. Alexandria Coughlin. Amina Yuchik. Taylor Mason. Almadina Nuhanovic. And Marina Stenchenko. I present the 2024 White Coat recipients. The students, once are assembled, will recite the White Coat Oath. Okay. All right. I'm going to stand back and try not to overwhelm their voices. Okay. Does everyone have their oath in front of them? Okay. Ready? As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider concerns, passionate and trustworthy manner in all respects of my care, apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patient, exercise sound professional judgment while abiding by legal and ethical requirements, accept a lifelong obligation to improve my professional knowledge and competence, provide, strive to protect the health and safety and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily, pluralization and responsibility with which I am trusted to the public. The students may return to their seats for our closing remarks. Return to your seats. I present our interim dean, Dr. Andy Russell, provost, sorry, who will offer his closing remarks. Thank you.
Good morning, everyone. I want to, the little one said hi. I want to first offer the congratulations on behalf of our president, Dr. Winston Sobiejo. When he learned that he had a conflict and had to miss this, he was really disappointed to miss it because there's no greater feeling than sitting on the stage and watching people come across and watch their families and supporters witness it. So congratulations to you on his behalf. When the governor of New York, Governor Hochul, was here in this building a few months ago and then down the path on our campus only a month or two ago, the main reason that she was here was to invest in us, to invest in you. And to do that, the reason to do that is because we need you desperately. And you know this, I think everybody in this room knows this, that we need new healthcare providers at all levels and in all ways. And so the reason that the state of New York is investing in us so deeply is because we are here to support you. We're here to support the faculty and the staff, but ultimately you, because we know that you, properly trained and educated, as you just demonstrated, will go on to care for me, my family, my children, your families, and people around the state of New York and beyond. So it is with deep gratitude that I say thank you and congratulations, and keep it up because we need you. Thank you.
Thank you all for joining us this morning. We're going to process out, and then we're going to take a photo out at the staircase. Thank you very much.
As the students gather to have their photographs taken, please, family and friends, join us in the reception area for cake and beverages. Thank you for coming today.